about the discovery of high lactate levels in multiple sclerosis and how that is linked to the progression of the disease, and most importantly, how this is linked to the cause, which is that MS is caused by a parasitic infestation. If we haven't met, my name is Pam Bartha, and I'm the author of Become a Wellness Champion and the founder of Live Disease Free. And I'm very excited to talk about this topic. Multiple sclerosis is very near and dear to my heart because I was diagnosed with multiple sclerosis over 35 years ago. By the grace of God and a lot of work on my part, I learned early on that what I was dealing with was a parasitic infestation. And so this has really, over the years, by God's grace, we've really learned more and more about the types of parasites that are causing multiple sclerosis. And today we have some incredible insights that I want to share with you that I've discovered. So what I would like you to do, what I would really hope that you would do, is to help us to get the word out. Please like this video. That gets it out to more and more people. We need to start talking about these topics. We need to start discussing the true cause. That's the only way things are going to change. So before we get into how this is linked to parasites, let's talk about what lactate is. So I'm going to keep this as simple as possible. I'm not going to go heavy into the science. I will talk a little bit about the science, but I want to keep it so that you guys understand what I'm talking about. So lactate is, let me just move over here. Perfect. Awesome. So lactate is lactic acid. And if you work out and you get burning muscles, that is a buildup of lactic acid. And in a normal, healthy person, your body will clear that lactic acid out in a short while, maybe in an hour or so. So later the next day when you still have stiff muscles, that's more to do with injury to your muscles, but it shouldn't be lactic acid because your body should clear, technically it should clear the lactic acid. But when we have multiple sclerosis, there are a number of studies showing that we have high levels of lactic acid in our blood, but also in the spinal fluid. So we're going to talk about the relevance of that. That's really, really significant. And early signs, so like basically if we get too much lactic acid in our blood, we can end up with a condition called lactic acidosis. And that would have symptoms that would include nausea and vomiting, exhaustion and fatigue, fast breathing, deep breathing, muscle cramps, and body aches. And so where does this lactate come from? We'll call it lactate, but it is the same thing as lactic acid. So where it comes from in theory, so this is the theory, just like multiple sclerosis, the theory is that it's our immune system attacking our nerve tissue. And so the theory of like why people that have multiple sclerosis, but other chronic diseases also, why they have higher levels of lactate in their blood and spinal fluid is that their mitochondria is dysfunctioning. So basically, in theory, with multiple sclerosis patients, they believe that there is an impaired energy metabolism. So your mitochondria are your little energy factories where it's making energy, ATP. And so they just believe that it's malfunctioning. You may have heard of mitochondrial dysfunction. A lot of functional medicine doctors talk about this. And so it's really believed that this is what's causing the high lactate. And it's believed that through this mitochondrial dysfunctioning, we end up with an increased breakdown of glucose for energy. And then we end up with it's not functioning properly, and because we're breaking it down more, then we end up with this energy penalty, which is less ATP supply. So ATP is the energy that the mitochondria is producing, and they just believe that with mitochondrial dysfunction, for whatever reason, they don't know why, that is why we're having this issue of a buildup of lactate in the body. And so we know that this can happen through we're going to talk more about the anaerobic glycolysis in a minute. So basically, what is the concern about elevated lactate. Well, if the lactate or the lactic acid is becoming too prevalent in your body, then this can lead to really serious health issues. I already mentioned some of the symptoms, but also can lead to death. And remember that lactate is an acid, and so that is part of one of the acids that would be causing us to be more acidic, and then we end up with mineral deficiencies also. So I wanted to share just even 3 studies where they are finding elevated lactate in multiple sclerosis, just so that you can see that this is the case. So the first study is a 2014 study, and the title of the study is Serum Lactate as a Novel Potential Biomarker in Multiple Sclerosis. And this study found that they summarized that, so they looked at 625 controls, so healthy people, and 613 people that had multiple sclerosis, and they found that lactate in multiple sclerosis patients was almost or nearly 3 times higher. So that's like a 300% increase in lactate. And this is in the blood, so in the serum in the blood of MS patients versus healthy people. And lactate in multiple sclerosis patients is higher in progressive multiple sclerosis than in relapsing remitting. And also it correlated more with higher levels of disability. So when you had, for people that had progressive multiple sclerosis, there was higher lactate versus relapsing remitting. And also the people that were more disabled with MS, they also had higher lactate levels. And so they felt that this might be a really good biomarker to help us in the diagnosis of multiple sclerosis. So a correlation between lactate concentration in the spinal fluid and a number of other inflammatory plaques reinforced the indication of increased glycolysis in MS due to, again, mitochondrial malfunctioning. So they're just assuming that we have increased glycolysis, we have an increase in breakdown of glucose in multiple sclerosis, our mitochondria is dysfunctioning, and that also correlated between the lactate concentration due to that increased breakdown of glucose with the number of plaques, the number of lesions. It correlated also. Then another study, 2016 study, here cerebrospinal fluid lactate is associated with multiple sclerosis disease progression. So that's a 2016 study. And here the spinal fluid lactate they found was higher in relapsing remitting patients than in controls. And patients with higher lactate in their spinal fluid had significantly higher scores on different surveys. You know, when you are diagnosed with MS, you might fill out a form which kind of, it monitors the progression of the disease. Like maybe you've heard of, I can't remember what it's called, I don't know. I'll share that with you later, but there's 3 here that they mentioned. So PI and MSS and BREMS. So those are 3 different surveys that they found that patients that had more lactate in their spinal fluid, they also had higher scores. So that would mean that they were not doing as well. And then, so the PI stands for the progressive index, and the MSSS stands for multiple sclerosis severity scale. And then the other one, which is the BREMS, is the Bayesian risk estimate for multiple sclerosis. Also, MS patients have higher levels of the lactate in their spinal fluid, and that was noticed on specific MRI images. So they're called proton magnetic resonance spectroscopy. And so these MRI studies showed a correlation between the spinal fluid lactate concentration and the number of inflammatory plaques. So the more plaques, the more lactate. Correlation there. A 2019 study also confirmed this, and they were looking at the lactate in blood and of MS patients, and they found that it is a suitable biomarker for diagnosing multiple sclerosis. That was a smaller study, about 40 people with MS and 40 control, but again, showing that serum lactate levels were significantly higher among MS patients than control. So this is, and I want to share too that it's not just in multiple sclerosis patients, that the high lactate is also in other neurodegenerative diseases and other diseases, but we're talking about MS today, and it's almost 3 times higher for sure in the blood, but also much higher in the spinal fluid. So why is that? Again, the assumption, the theory is just that it's our mitochondria. We're not breaking down we're not metabolizing glucose like we should, and we're ending up with a whole bunch of lactic acid produced when it shouldn't be. They're assuming that. It's just like they're assuming that our immune system is attacking our nerve tissue for no apparent reason. And when you look at the scientific literature, and I would encourage you to do this, and it didn't take me very long at all to do this, but I wanted to also mention that we will have our blog post published by Friday late afternoon at the latest this week, and there you'll be able to access and you'll be able to get all the links for these studies. You'll also be able to read my notes or watch a shorter version of this video, and there you will be able to go deeper if you want into this topic. But it's when I did this digging, I thought, okay, so we don't know what's causing the increased lactic acid production or the lactate production in MS. They say it's just happening because our mitochondria is just dysfunctional for no apparent reason. But let's see, are there certain parasites that are linked to multiple sclerosis that I've shared in previous talks and events where there's evidence, so like candida and filarial worms and roundworms and also malaria. So any of those parasites, do they produce lactic acid? Yes, they do. So it's really interesting. So parasites produce lactic acid through anaerobic glycolysis. So that means that they're breaking down glucose without oxygen. Anaerobic means without oxygen. So parasites produce lactic acid or lactate when they are trying to get their energy, and they do that through anaerobic glycolysis, breaking down glucose without oxygen. So the most startling parasite that I found that produces a lot of, well, it's not the only one, but it does produce a lot of lactate, would be malaria, the protist that causes the disease malaria. And so with this parasite, and remember I shared, and I've got at least a 5-part series on malaria and multiple sclerosis, so please go through that. If you haven't, it's on our website, on our blog posts, you can find them there. And so the parasite that causes malaria, when it is infecting our red blood cells, so that is what it does, but at different stages of life, it's maybe in different areas, but during the stage where it's infecting the red blood cell, it produces its energy mainly through anaerobic glycolysis. And this is where there's a buildup of a certain, it's called pyruvate. I'm trying to keep it simple here, but it's converted to lactate or lactic acid. And so the increased lactate production in malaria cases, in people that have malaria, is caused by several factors. So it's not just that the malaria parasite is breaking down glucose in anaerobic glycolysis, producing a lot of lactate. That's one way. But also when we have these parasites in our body, then our immune cells, they have to be more active and they need more energy. And so they also are they're increasing lactate production. So it's a breakdown it's a breakdown of the glucose by the parasites, also anaerobic glycolysis by activated immune cells, and then also an increase in anaerobic glycolysis by cells that are cut off of oxygen. So when we end up with a lot of these parasites, they infect our red blood cells. The malaria parasites infect our red blood cells. The RBCs, the red blood cells, can become dysfunctional. We can become anemic. some of our tissue can be low on oxygen. So then those cells are going to have to burn glucose anaerobically without oxygen. So it's the parasite themselves using a lot of glucose, like they need energy. So they're breaking down glucose. So they have energy through anaerobic glycolysis, but it's also our immune cells that are a lot more active, needing to go after these parasites, whether aerobically or anaerobically. Normally aerobically, but if there's tissue damage and there's decreased oxygen, then they would have to do anaerobic without oxygen. So when I did a quick review of the research, I found it really easy to find studies talking about, high lactate production with malaria. And actually, with people that are really sick with malaria, they do end up with this acidosis, this lactate acidosis. Let me just see the proper term of it here. So lactic acidosis. So that is, and it can be fatal. So it's really linked with a high production of lactate. So then I went and I thought, okay, well, let's talk about flukes, because we know that schistosomiasis is, well, intestinal flukes are definitely a problem. Schistosomiasis is definitely also an issue. And do they produce lactic acid? Sure enough, and also filarial worms, because remember, Dr. Alan MacDonald found filarial, small, round nematodes, filarial worms, in the central nervous system of every MS subject he tested. So let's first talk about the schistosomiasis, or the flukes. And yes, definitely they use anaerobic glycolysis, so they're breaking down glucose without oxygen. That is predominant in both the the flukes and the filarial worms. So for example, one study talked about in 1 hour, schistosome, they can metabolize, so these flukes can metabolize an amount of glucose equal to 1/5 of their dry weight. And in contrast to other helminths, schistosomes convert glucose quantitatively. So they will convert glucose to lactic acid much more than other worms. And then carbohydrate metabolism in adult flukes may exclusively lead to lactate formation, so they can completely convert it to lactate. And then anaerobic and aerobic production of lactic acid by filarial worms is also another concern. So they can produce lactic acid either aerobically with oxygen or anaerobically when they're breaking down glucose. So those would be the filarial worms that Dr. Alan MacDonald talked about. So one study shared that aerobically, so if these filarial worms are present in oxygen, then 30 to 45% of the glucose used by these worms is converted to make energy into lactic acid, whereas 25 to 35% of, oh, sorry, never mind, I won't go into that. That's not going to be helpful for you. But anaerobically, so in an environment without oxygen, over 80% of the total carbohydrate removed by the filariae, by the small filarial worms, was metabolized into lactic acid. So they, in an anaerobic environment, the filarial worms were metabolizing 80% of the glucose they used for energy into lactic acid. So filarial worms, yes, definitely can produce a lot of lactic acid. Malaria, absolutely. Flukes, the schistosomiasis, definitely. The blood fluke, possibly the intestinal fluke. I haven't looked at that, but they're all the same family, so they're all part of the same type of parasites. Then I looked at Lyme disease, because that's really linked with multiple sclerosis also. And we know that the MS Society talks about the link between MS and Lyme disease. So just one study that I found, when encountering Borrelia is the bacteria that causes Lyme disease, immune cells dramatically increase their level of glycolysis, so that's the breakdown of glucose, leading to increased production of lactate. So here again, our immune system, when they encounter Borrelia, they are definitely going to be needing more energy to go after the parasite. And so they really increase the production of lactate, again, which is lactic acid. Then I looked at Candida, because that has been really linked a lot with MS with multiple sclerosis and other chronic diseases, and found that the growth of Candida albicans on lactate, which is a non-fermentable carbon source, it actually modulates their interactions with our immune cells, and which is really interesting. So you know how a lot of us have fungal overgrowth, and when I was first diagnosed with multiple sclerosis, a lot of the early doctors thought that MS was caused by Candida because it was very common to see signs and symptoms of Candida infections in people that have multiple sclerosis. But is it that Candida is the cause, or is it that it's an opportunist? So if there's going to be high levels of lactate, it looks like Candida albicans can use that as a carbon source. And when it's using lactate versus glucose, then it's less visible to our immune system. That's what the study said. Lactate. So when they grew Candida albicans on media that had lactate, the yeast cells were less visible to the immune cells than when they were grown on glucose media. So media is just where they're growing, they're doing studies, right? And so that's really interesting. So maybe we have, these different worms, and we have, maybe many of us do have a malaria babesia type protist. And we know that it's probably not just one parasite because our students are recovering using many different treatments. But then if we have all these parasites that produce a lot of lactate, and then Candida is just going to thrive on that and may be less visible to the immune system. So the immune system may not be dealing with it as much because it's using more lactate versus glucose because there's so much lactate available. Then I looked at Ascaris worms because a lot of our students are passing large roundworms also. And I haven't done an exhaustive study on this, but just a quick study, a quick look. It was really hard to find, virtually, I didn't see anything indicating that Ascaris large worms produce a lot of lactic acid. However, I did find that they produce only very little lactic acid. So many of us have the large roundworms, but so do people that don't have multiple sclerosis. So they can cause a lot of other symptoms, but maybe they don't produce the lactic acid. And that's interesting. So this is yet another really, really important topic because we are just literally assuming that the immune system is attacking the nerve tissue for no reason in multiple sclerosis. And we are not willing to look at anything else except for lesions and looking in the spinal fluid for antibodies, which are produced in response to infection anyhow. And so, you might want to ask yourself, why? Why is it that the panel of experts that dictate how we diagnose and how we treat multiple sclerosis, they're not interested in this information, right? They're not interested at all. They talk about, maybe we could use it to help as an early diagnosis for multiple sclerosis. But lactate is also higher in other diseases also. So it's not really going to be specific to MS, but it is, if you have MS, then you will have higher lactate, many times higher, up to close to 3 times higher lactate, especially the sicker we are. So progressive versus relapsing remitting, or how disabled we are, we will have more lactate. So why is it that they're not interested in this when we know that high levels of lactate can make us feel really sick, that they are produced by various types of parasites? And again, it's just another really big clue that multiple sclerosis is an infectious disease. I've shared with you lots of different studies of different types of parasites that will produce lactate. So I'm going to go to your questions and to your comments here. Hello, Bella. Yes, the McDonald criteria, he found small filarial worms in every MS subject that he tested, in 10 out of 10 subjects. And he found many, not just like one or two, they were abundant in the spinal fluid, especially mating in clusters. A lot of the debris from their waste in the spinal fluid, it was chalky. So very relevant. I've done talks on that. You can find those on livediseasefree.com. Also, he found developing tapeworm larva, so the immature form, but he also found developing tapeworm. So I didn't get a chance to look up tapeworms and lactate production. I would assume probably not, probably similar to the roundworms, but definitely, like, we know that flukes can cause a lot of inflammation in the body. I'm going to share something with you that really freaked me out. Yeah, as I do my research, I found out, have you guys ever had swimmer's itch? That is caused by a fluke. And so it's normally like in a certain area of a lake, like if there's birds that are infected, ducks or geese, and they kind of live in an area and they're infected with a fluke, and they infect the water, and the flukes can live in the water. And so if you swim there, you get this swimmer's itch. And I thought that swimmer's itch was caused by a bacteria. My son had a really bad case of it years ago where we were all swimming. I don't think I was in the water, but we were like, our family was swimming in the water. And then, like, I can't remember, it was like the next day, he had these huge welts on his legs, like really big, probably like that big. Because some people get like a little rash, but he had really big welts, and he went to the doctor and we found out it was swimmer's itch. And I just assumed that swimmer's itch is caused by bacteria. But in my research, I've discovered that it's caused by flukes, by blood flukes. And so these blood flukes, they infect the birds, but they can also infect mammals. And so they end up going through your skin. And if your immune system doesn't get rid of all of them, they end up in your blood. And so you're not going to get a really big, huge issue with them automatically. But if some of them get past the immune system and get into your blood, they eventually reproduce slowly. You might not feel quite as well, right? More tired, whatever. And then they move into different organs, and they can cause a lot of problems, and they can cause bladder issues. They can move into all different parts of the body. So that's one instance in Canada where doctors should know that this is a blood fluke, that it can infect mammals, that if somebody has a really big case of the swimmer's itch, that they should be treated, right? Early, like early intervention. So now I have to tell my son, like, those were flukes. They're disgusting. And, you got to keep an eye on your symptoms. Make sure that you don't end up with, bladder issues or other symptoms that are associated with blood flukes. Really important. So, because we normally don't even think about flukes, for example, even intestinal flukes. And that's something that I'm sure that I've had. That's what it looks like. They're 3 to 5 inches long. And I probably got them from the farm, like when I was on a lot of antibiotics and then helping my dad in the pig barns. I'm assuming they came from pigs, but they could have come from somewhere else too. I don't know. But all I know is that we are really, really ignoring parasites, and they are all around us. We don't have to be paranoid. I'm still going to swim in the lake. Definitely not so much where I see a whole bunch of ducks or geese hanging out. And definitely, if you end up with swimmer's itch, look into it. And I personally would do like a little preventative quick treatment, because you want to prevent things in the future. So this is really, really huge. And I hope that you guys will share this with other people, because this is the only way things are going to change. Hi, James. Hi, Daniel. Can cilantro help you reduce lactate glutamine in the body? No, I don't believe so. I can look into it, but cilantro is more of a metal detoxer. It will help to remove other toxins in the body, but lactate is more like of an acid. And so I'll look more into that, but something that would neutralize acid would be minerals. So I'm not going to guess as to what. All I know is that when this helps us to understand who we're working with too, our students. So when I know that they're really sick and they have multiple sclerosis, the more sick they are, the more acidic they will be. And so we will definitely address minerals. So the minerals will help to neutralize acids. We do become deficient in minerals when we have a lot of acids. And like the biggest thing is to stop feeding the parasite so much, because that will really help to decrease the production of the lactate or the lactic acid. Absolutely. So diet is number one, and giving extra minerals would be number two, I would think. Thank you so much for your kind words. I really appreciate it. And it just drives me crazy that we need to get the word out. So please help me get the word out by liking this video, sharing it with different groups. That is how the algorithms get the videos out. David, some endurance athletes reduce lactic acidosis with sodium bicarbonate. Yes, I know that. And I didn't want to mention that because you have to be really careful with baking soda. If you just drink a bunch of it, they retain water and they can feel horrible. They become puffy. So that's something that you really would have to know what you're doing with that. So I personally, I wouldn't do sodium bicarbonate. I would use more just trace minerals. And then Laura, you need high nitric oxide foods, beets. So the problem with beets is they're really high in sugar. So we wouldn't use that because that will definitely feed the infections, the sugar. The parasites don't care where the sugar comes from. And so low thiamine schistosomiasis uses thiamine, niacin, and B5. So that's why it's really important not to take mega doses of the B vitamins when you have parasites, because sometimes when we're taking mega doses of B vitamins, we're feeding the parasites, or even the high doses of vitamin D. We want to be really careful. And yeah, so schistosome, like the flukes, they cause I've got some videos or even a blog post on flukes, and go and watch those. Like, especially, I don't know if I did the blood. I think I did. I think I talked a little bit about liver and blood and intestinal flukes, but they're nasty. They cause a lot of inflammation, and we see them very often in our students. You're so very welcome, David. You found out about parasites many years ago before you found us. Awesome. And I've confirmed a lot for you. Great. Let's see here. All right. So I just wanted to mention too, because a lot of you might be thinking, well, my doctor is not going to treat parasites. Like, sure, like all of this information and research, but I don't know where to go. Like, how do I get help? How do I get somebody to help me to treat the malaria or the candida? It's usually several different parasites. And I can share with you that I talk to people every day. And the exciting thing is that there's more and more practitioners that are interested in parasites, that are interested in and open to helping, but they lack the skill. They don't understand how to treat well. So this is where like they don't know like protocols for the parasite drugs, but the parasite drugs on their own are not a magic cure either. And so if you found me and this is new to you, then make sure to watch some of my videos, my masterclass training. I share a lot of research about the types of parasites that cause MS and a lot of case studies, and I share the steps that we take to recover through the Live Disease-Free plan. And then if you're at that place, you're like, great, but I don't have somebody to help me. We can help you in the Live Disease-Free program, the Live Disease-Free plan. So make sure to watch my masterclass training if you need support, if you need somebody to help you to figure out a game plan of, which treatments and what would be most helpful, which testing is important, because you can spend a lot of money on testing and on supplements, and you'll find that you're no better off. And we see that every single day in the people I talk to. But what we recommend is just keep it as simple as possible and make sure to get ready to treat. So decrease the carbs, support the body, and then in as little as 3 to 6 weeks, it's up to you. As soon as you have those things done, then start treating. And you don't need a lot of tests. We don't recommend a lot of supplements because they will feed the parasites, depending on which supplement it is. There's a couple that can be helpful, but not many. And you don't need a lot of tests, just basic blood work, making sure that your liver and kidney function is fine, and supporting your physiology. So if maybe your iron is low or your thyroid is low, your adrenals are suffering, things like that, you want to support your physiology before. But I found this really, really interesting with the malaria part, how it is a massive producer of lactate and how that's linked with MS. I think we're getting closer and closer to, and malaria, it may not be malaria, it might be babesia, it might be a different protist. They're related, they're treated the same, but whatever it is, it's a protist that infects red blood cells. So, and then in the program, I help you to build the plan. I help you to access the treatments, the practitioners, everything, because you are going to have to respectfully direct your practitioner to make sure that you're using effective treatments and effective doses. Otherwise, it's not going to really do anything. And so that is how we are able to recover. And so I actually just had, we have a pharmacist who's in our program right now. And she just reported yesterday that she is symptom-free. She's done a few treatment cycles and she is completely symptom-free right now too. And that's so incredibly exciting. We have doctors that take our program. We have many, many nurses that have taken our program, veterinarians and physiotherapists. They can't get well with our standard of care because our standard of care will not treat the cause. But you guys have the answer. I'm sharing that with you every week. So a couple more questions here that I'll go to. Let me see here. Let's see. You need fiber, carbs. They're not all created equal. So Laura, like the Live Disease-Free diet, you can find that on our website. And when you decrease the carbs low enough, people notice significant symptom improvements. And so this has all to do with the breaking down of glucose. I've shared in this video and in past that glucose is the favorite food of parasites through anaerobic glycolysis. And so that is why decreasing the carbohydrates enough, it's life-changing for people. And the important thing is to decrease it enough, because if you just decrease it substantially, you may not notice enough symptom improvement. But if you get down to the 30 total grams of carbs, that's really where we see this sweet spot. All right, one or two more here. So vitamin D feeds parasites, high doses, yes. Will feed Borrelia, really enjoys high vitamin D. So that's why it's not good to have high doses of vitamin D. Beets also do not have, so we would not have beets in our recovery because of the sugar content, the high, so it's a root vegetable. We would have small amounts of carrots, like as a garnish. You could do beets as a garnish, where you're having a huge salad and just a very, very small amount. But the parasites really don't care where the sugar comes from, whether it's fruit, beets, carrots, etc. Okay, I'm going to let you guys go. So again, if you enjoy this research that I'm sharing with you, helping you to understand why you're sick, helping you to understand what's causing chronic disease, helping us to bring change to the world, make sure to like, share, and subscribe to this channel. And then also, if you need support, make sure to reach out, watch my masterclass training. And then if you need my support, you will be able to book a time with me, and I'll answer all your questions if you have any questions, and I would be honored to support you. So I hope you guys have a wonderful week. Take care and bye-bye for now.